We are facing in our culture what many regard as a crisis of mental health, especially of depression and anxiety. The rates of death by suicide have increased over the last 20 years in the United States, and there's a lot of work going on in psychiatry around neurobiology and genetics. But it's clear that it's not all genes and it's not all neurobiology. It has to do with ways that we're living together as a people. It has to do with the way that people feel either connected or disconnected from their communities and from a sense of a future.
When you listen to people's stories, when you actually listen to the experiences they go through, what people's desires are, you discover it's the same as everybody else. People want friends, people want love, people want acceptance. Listening carefully to people's stories gives a different way of thinking about it. And I think that different way of thinking about mental health opens up big spaces for the church, for example, to offer particular ways of care and healing.
Here at Duke, we're forming a mental health track of our Certificate in Theology and Healthcare program. The mental health track of the Certificate in Theology and Healthcare is for those who are deeply involved in mental health work, especially mental health clinicians, social work therapists, licensed marriage and family therapists, psychologists, psychiatrists, others who are involved in the work of mental health care who may never have imagined that they would have the opportunity to study in a seminary, but are longing for the kind of formation that seminary training can bring. But not only seminary training, to be able to do it in a community of like-minded mental health clinicians who are also deeply wanting to connect their work with their Christian faith, to imagine together what a Christian vision of mental health care might be. We designed this program as a hybrid program that allows practicing clinicians who can't just pack up and move to Durham to study full-time at Duke Divinity School for a year to study with us. It involves a week in residence in late August and a week in residence in January here at Duke Divinity School, learning in person in community. And then the rest of the 2 semesters is online learning in classes that are specifically designed for working healthcare professionals. And so this allows those who are in practice, but who have this interest, to study while they're also working and continuing their practice. And in fact, we want people that are practicing on the ground because we want this to be a formation program that people can actively reflect on the work that they're doing and to do so in community and to do so in a way that brings energy and joy to that ongoing work.
What excites me about the Theology, Medicine, and Culture Initiative is the opportunity it provides people to respond to their thirst to integrate theology with their daily experience in healthcare.
I think theology and practice are really very much tied together. And a program like this enables that connection between theology and practice to be brought into mental health care in ways that hopefully will be creative and healing.
If this is something that's resonating with you, we would invite you to visit our website and to reach out to us to explore your next steps.